The World Health Organization is convening an emergency meeting today to study possible vaccines or treatments for Ebola after sounding the alarm about the speed and scale of the latest spread of the virus in Africa. More than 130 people have reportedly died, with a total of around 500 suspected cases in both the Democratic Republic of Congo and Uganda. The UN Health Agency is warning of a lengthy outbreak unlikely to be over in 2 months. The Africa Centers for Disease Control and Prevention has declared a continental public health emergency. WHO Chief Tedros Adhanom Ghebreyesus earlier designated the outbreak an international health emergency. William Denselow for CNA joins us live from Brussels. Will, that emergency meeting at the WHO today, what can we expect from it?
Well, you mentioned that declaration from Dr. Adhanom Ghebreyesus over the weekend declaring this Ebola outbreak as a public health emergency of international concern. He says this is the first time that such a move has been made before an emergency meeting. He said the reason for that is that this is not a decision taken lightly, and he wanted to see the international community moving at speed. When it comes to what could come out of this emergency gathering, well, this is really an opportunity for the WHO to come up with temporary recommendations, essentially how to try and keep this outbreak somewhat in check. They've already praised authorities in places such as Uganda for cancelling some major public events to try and break down and try and prevent community spread. So we can expect more pledges for investment from the international community, as well as more steps on what tangible action can be taken on the ground in places like Eastern DRC and Uganda to try and mitigate the spread of this Ebola outbreak.
Your suggestion that recommendations hoped for from this meeting to somewhat keep the spread of Ebola in check, suggestion that current efforts are failing to do that.
Well, you mentioned the speed and scale that really is concerning the World Health Organization. You mentioned some of the figures that really have underlying concerns for the WHO and the WHO chief. If you look a little under the hood, you mentioned those 500 suspected cases, real concerns there about what that could mean for wider community spread going forward. So that gives you a sense of the concerns when it comes to the scale of the Ebola outbreak, and when it comes to the speed, real worries as well. The reason for this, the WHO mentions that the outbreak has been seen in urban areas, places like Goma in the east of the DRC. The fact that it's healthcare workers that are among those that have picked up this infection, real worries there about what that means for wider community spread. Also, the fact is that this is these are areas with high population movement, so real worries there about how quickly this infectious disease could spread beyond borders and beyond communities. So these are just a number of reasons why the WHO has convened this emergency meeting, and indeed why they're urging the international community, not just those nations impacted immediately, to take stronger action.
Oh, thanks. William Denselow for CNN in Brussels, looking at this emergency meeting at the WHO over the Ebola outbreak in Central Africa. Thanks for that.